Today, let's delve into a book published in July 2023, titled Random Acts of Medicine: The Hidden Forces That Sway Doctors, Impact Patients, and Shape Our Health. This book has two authors. Anupam B. Jena is a professor of healthcare policy and medicine at Harvard University, a practicing physician at Massachusetts General Hospital, holds a Ph.D. in economics, and is also one of the hosts of the blog program Devil's Economics. Christopher Worsham is a practicing physician treating lung diseases in the intensive care unit at Massachusetts General Hospital and a healthcare policy researcher at Harvard Medical School. Both individuals are not only frontline practitioners and researchers but also actively engage in social activities. They possess first-hand data and expertise in economic thinking, making them an ideal combination of intelligence and efficiency. The book explores the role of randomness in medicine through natural experiments. In simple terms, seemingly small factors can have significant effects on health. Health is not just about maintaining a good lifestyle and having access to quality healthcare when sick. It's more complex than that. Let's take an example. How harmful is car exhaust? We know that in the past, toll booths on highways were manually operated, requiring drivers to stop, pay, and then proceed. Many cars stopping at toll booths caused traffic jams and increased exhaust emissions. A study focused on two toll booths in Pennsylvania and New Jersey that suddenly switched to automatic toll collection. With this system, vehicles could pass without stopping or slowing down, and the toll was automatically calculated. As a result, the toll booths no longer caused traffic jams, leading to a reduction in exhaust emissions. Now, how does this change in exhaust emissions affect the health of residents near the toll booths? Researchers found that after the introduction of the automatic toll system, the average preterm birth rate decreased, and the average birth weight increased for infants born in these areas. All this, simply because the toll collection method shifted from manual to automatic. Of course, you must be very cautious in drawing such conclusions and rule out other possible factors. For instance, is it possible that, after the toll booth traffic decreased, some health-conscious individuals moved to the area, thereby raising the overall health level of the entire region? Researchers investigated reproductive females in the vicinity and found that factors such as their education level, race, rates of teenage pregnancy, and smoking habits remained unchanged. Additionally, local property prices showed no variation. The only change was a reduction in air pollution. Despite being close to a highway with initially high exhaust emissions, merely reducing traffic congestion at toll booths had a significant impact on the health of newborns in the vicinity. Here's another study. Air pollution significantly affects the elderly, but the pollution level is variable, depending on the direction of the wind. For instance, if there's a polluting factory nearby, the impact on elderly individuals in the area depends on which way the wind blows. Can this effect be observed? Yes. The research discovered that on days when the wind blew pollutants toward the area, the mortality rate of elderly patients increased, and it decreased on days when the wind blew pollutants away. It's hard to imagine someone's life ending due to a change in the wind direction over a couple of days. Instances like these are called natural experiments by researchers, where natural, random control experiments occur. Before and after the toll booths changed their collection method, the composition of residents nearby should theoretically remain unchanged. The direction of the wind shouldn't be determined by the health status of nearby elderly individuals. Therefore, these randomly emerging factors effectively divided the population into two groups with no initial differences. Their only distinction was that one group was affected, and the other was not. Consequently, any subsequent differences in their outcomes could only be attributed to that factor. This involves a lot of careful consideration to eliminate various interfering factors. The scientific study of the validity of natural experiments even earned the Nobel Prize in Economic Sciences in 2021. With natural experimental methods, we can measure the impact of factors that are otherwise challenging to assess. Let's look at a few more examples. When Barack Obama was elected president in 2008, he was only 47 years old, with enviable black hair. However, after just 2 years in office, his hair turned gray. You might guess that being president was too exhausting. However, this one example doesn't prove anything, so we need statistical conclusions. You can't randomly select two groups of people, make one group president for a few years, and observe the impact on their health. Fortunately, the authors of this book, Jena and Worsham, used Obama's initial political opponents as a control group. Logically, these two candidates should be similar in various medical aspects, especially since voters wouldn't intentionally choose someone with poor health. Therefore, if you can prove that, on average, the life expectancy of the person who became president is shorter than the life expectancy of the person who competed against but didn't win, you've demonstrated that being president is detrimental to health. Jena and Worsham examined elected leaders of democratic governments. Presidents, prime ministers, and leaders of 17 countries worldwide. Comparing them with their initial competitors from the first election in 1721 to 2015. The final conclusion was that the average life expectancy of elected leaders was 2.7 years less than that of their defeated opponents. Of course, this is only a statistical result and doesn't reveal the mechanisms behind it. Is it because the president's job is too busy, with irregular working hours? Is it due to excessive stress and criticism? Is it because of the post-retirement disappointment of returning to an ordinary life? We don't know. Also, this is an average effect, and the degree of impact varies for each individual. But the conclusion stands firm. If your life goal is to live longer, you might want to reconsider becoming president. Do you know what else is as dangerous as being president? Winning a silver medal at the Olympics. Winning an Olympic gold medal is the pinnacle of one's life, and even a bronze medal is acceptable. After all, you still have an Olympic medal. However, winning a silver medal brings not joy but regret. A silver medal equals, why did I fall short by just that little bit? In high-level competitions, the difference between the first and second place is minimal and often determined by random factors. When athletes receive their medals, gold and bronze winners are smiling, but the silver medalist wears a disappointed expression. So, you wonder, how much impact can this disappointment and regret have on a person's health? A study examined the lifespan of gold, silver, and bronze medalists from the Olympic Games between 1904 and 1936. The average lifespan of gold medalists was 73.2 years, bronze medalists lived an average of 74.8 years, while silver medalists had an average lifespan of only 70.8 years. In other words, silver medalists lived 3 to 4 years less on average than gold and bronze medalists. That's a lifetime of regret. Of course, because this study had to wait for athletes to complete their lives, it focused on early Olympic participants. Modern athletes participate in more competitions, and their sports careers last longer. A silver medal in one event might turn into a gold medal in the next, so the regret might not be as significant. Speaking of a lifetime of regret, it reminds me of a story circulating online. In the 1990s in Beijing, an elderly man, during the unit's housing distribution, was originally allocated a large apartment. However, he didn't want it because the unit required a small fee based on the area. To pay less, he deliberately gave gifts to the leadership and exchanged the apartment for a smaller one. Little did he know that a few years later, property prices skyrocketed, and he watched the value of that large apartment increase. He felt immense regret. After retirement, the old man's condition became very poor, almost like he was cursed. No one could mention the word house in front of him. It's not just regret. It's more like carrying a lifelong grudge. Chinese people often say, be more open-minded, and indeed, it makes sense. Think about it, just winning a silver medal could reduce your lifespan by 3 years. You really should be more open-minded. Sharing these stories isn't to emphasize the need to be more open-minded but to highlight how random factors can affect health in unexpected ways. Now, you might think, aren't humans too fragile? Don't worry too much about it for now. We've managed to live this long despite our fragility. In reality, random factors can be both good and bad, and an individual's life is the result of their comprehensive influences. Some negative impacts combined may even lead to diminishing marginal effects. However, every influence is real. This doesn't present a threat but an opportunity. Since the effects of negative influences are so clear, avoiding a few of them could significantly improve your outcomes. Especially when research shows that paying a small cost can prevent a negative impact, it's definitely worth considering. For doctors, there's an opportunity that's almost like picking up a bargain, and that's getting the flu vaccine. Numerous studies confirm the effectiveness of the flu vaccine. For example, Japan mandated influenza vaccination for school-age children starting in 1977, leading to a decline in flu-related deaths. In 1987, parents were allowed to choose not to vaccinate their children, and from 1994, the government stopped vaccinating school-age children. The result? An increase in deaths from influenza. However, not getting vaccinated is also a right, and matters like these are difficult to clarify. Yet, Jena and Worsham explored a more minor factor. The U.S. flu season generally begins in November, and ideally, vaccinations should happen in October. The vaccines are distributed to various locations in September. Adults can get vaccinated at convenience stores, but children must go to hospitals. Smaller children usually have annual checkups around their birthdays. This is crucial, and parents will make sure to take their children. If the hospital has flu vaccines during the annual checkup, it's convenient to get vaccinated at the same time. This means that children born in September, October, and November will conveniently receive their vaccines during the annual checkup. However, for children born in earlier months, their parents must make a separate appointment and possibly take time off work to get the vaccine. Some parents might find this troublesome and choose not to vaccinate their children. It's just this minor difference, shown in this graph. For the 2 to 5 age group, children born in September, October, and November have a significantly higher vaccination rate compared to children born in other months. Specifically, the vaccination rate for children born in October is 55%, while for those born in May, it's 40%. This 15 percentage point difference is substantial and directly affects the likelihood of infection. Looking at another graph, the probability of children born in the summer getting the flu is around 5.4%, while for those born in October, the probability is only 4.15%. All because of that little bit of convenience. What if we make things a bit more convenient? Randomized trials have shown that if hospitals go directly to schools to administer vaccines to children, it significantly reduces the infection rate. For instance, patients with heart disease need to take medication regularly, but many patients don't take their medication on time. Is it because the medication is too expensive, and they can't afford it? A study divided patients into 2 groups, one receiving free medication and the other paying for it. However, both groups had to go to a specific location regularly to get their medication. The result? The average medication adherence rate for the group that paid was 39%, and the free group was only slightly higher at 44%. It's not about the money. Most people don't take their medication on time simply because it's inconvenient. Or, most people only don't take their medication on time because it's inconvenient. Isn't that terrifying? After putting in so much effort to research and develop a drug, doctors diagnose you correctly, the drug is affordable, but you don't take it. Just because you find it inconvenient? Because of an upgrade in toll booth technology, healthy babies are born. Premature deaths occur due to a change in the wind. Regrets over missing a gold medal by a step lead to living 3 fewer years. And because a birthday coincided with the availability of a vaccine, a child avoids a bout of the flu. These things make doctors feel helpless. Medicine is not just about solving health issues. In the next section, we will discuss the challenging issue of medical diagnosis.
If you feel there is value in this, please like, subscribe to this channel, and leave your thoughts or suggestions in the comments section. Let's grow together and read more good books.